Thank you, Sue. It's really my pleasure to join you today. I really do love talking about diabetes, and if I can help anyone get through the holidays with these tips and tricks, all the better. I have no disclosures today, and today we're going to be talking about how to navigate the holidays with diabetes. As you're probably aware, diabetes is very common in adults. Roughly 10% of the population has diabetes, and probably another 30–40% of the population has prediabetes and may not know it. More common in adults is type 2 diabetes, but we also see type 1 diabetes, which is the autoimmune form of diabetes. And so this information will apply to both patients with type 1 and type 2. So we're going to focus on 6 tips for winter and holiday challenges with diabetes. First, we'll talk a lot about nutrition and diet and the importance of monitoring your weight during the holidays. We'll talk about how alcohol impacts your blood sugars and what the recommendations are around alcohol intake. We'll talk about the importance of staying active during the holidays and how to do so with the colder climates. We'll talk about making sure you keep up with your medications and glucose checks during the holiday season. How colder temperatures can impact your feet and what are the risks to be aware of. And talking about depression through the holidays and how the shorter days can impact your mood. So first and foremost, I want to say that I am so excited about the holiday season, and I hope you are as well. And really, you should use this time to spend time with your family and your friends and enjoy yourself. Sometimes the focus is strictly on food and sort of festivities, but also make sure you participate in decorations, music, spending time with family and friends. And we'll talk about how to enjoy the food, but plan accordingly to minimize the impact on your diabetes. Some of my patients tell me that they're going to skip breakfast, skip lunch in preparation for the Thanksgiving dinner because they want to make sure they have enough room in their stomach for the Thanksgiving meal. But that's not recommended when you have diabetes. You really want to make sure that you keep up with your 3 meals per day and you don't skip meals. What happens when you skip meals is you tend to overindulge at the subsequent meal, and that's not healthy. So make sure you don't skip meals during the holidays. Planning is key when you have diabetes. Try not to go to any gatherings hungry, just like you don't want to go to the grocery store hungry. You want to make sure that you have something in your stomach and you fill up on low-calorie foods to a certain extent before you go to the gathering. Think about bringing a dish to share that has lower carbohydrates, low fat, and low calories. Bring it to the gathering so that you can use that to help fill you up. Make sure you don't forget to bring your diabetes supplies with you and take your medications as prescribed. That may be an oral medication or that may be insulin. And lastly, make sure you stay active. Park a little farther if you can at the grocery store. Walk the stairs instead of taking the elevator at the mall. Try to stay active as best as possible. So what happens when you have diabetes and it's cold outside? Well, one thing to be aware of is insulin and test strips don't do well in the cold. So insulin has sort of a recommendation as to what temperatures it should be stored at, and it shouldn't be stored below 36 degrees. So it's not something you want to leave in your car, especially if it's freezing. Similarly, if you're going on vacation, it's not supposed to be above 86 degrees. So if you're going to be walking around Disney World and, it's hot, you have to be aware of that. So make sure you're aware of the temperature that your insulin is and plan accordingly. Now, test strips also have sort of a recommendation temperature that you're supposed to keep them at. Every brand is a little bit different, but the general rule of thumb is try not to leave the test strips for more than 30 minutes below 45 degrees. So if you're taking a hike in the woods and it's below 45 degrees, or you're maybe going skiing, you have to be aware of where your test strips are located and plan accordingly. When we think about checking our blood sugars, often we're doing finger sticks, and in the cold, you don't get good circulation to your fingertips. And you can get a falsely low blood sugar reading if you don't have good circulation. So before you check your blood sugar, make sure you wash your hands really well with warm water so that you get good blood flow. Similarly, you want to make sure you don't have anything sugary on your fingers. If you had, say, something sweet at the end of your meal, like maybe a cinnamon bun, and some of that's is left on your finger, it can give you a falsely high reading. So wash your hands really well. And do your best to avoid getting sick. Certainly follow the recommendations around getting a flu vaccine, the COVID vaccine. Be aware that certain medications for colds and flu do have a lot of sugar in them, especially cough syrups and whatnot. So read the packages, and tablets may be better than the syrups. So tip number 1 is really to watch the scale and watch your food intake. Research shows that most people gain on average 5 to 7 pounds in the winter months, and that is associated with higher blood sugars and a higher hemoglobin A1C. Now, recommendations vary as to how often you should weigh yourself when you have diabetes. Some people recommend once a day. Some people recommend once a week. I would say at least weigh yourself once a week, and try to do it at the same time of day, whatever you decide, with the same clothing, whether it's no clothing or maybe undergarments, the same thing every time you weigh yourself. And that allows you to monitor your weight. We'll talk a lot about how to keep up with healthy eating habits in the holidays, and keep moving best as you can, any opportunity that you get. So I really like this recommendation from the American Diabetes Association. It's how do we fill our plates during the holidays to stay healthy? And we'll talk more about this in the next couple of slides. But really, half of your plate should be vegetables and fruits. And by vegetables, I mean non-starchy vegetables. So things like potatoes, sweet potatoes, I would consider those starchy vegetables, and they go in the grains section. So vegetables and fruits. Green beans, cauliflower, broccoli, Brussels sprouts, salad, and fruits. So half the plate. The other half of the plate is broken down into half protein, usually meat, fish, and grains. Potatoes, sweet potatoes, those sorts of things. When we think about holiday meals, often there's appetizers before the main meal. And the best low-calorie option, if it's available, is to fill your appetizer plate with vegetables. That limits the amount of calories you'll intake during the appetizer portion of the meal. When you're out and about, maybe doing shopping or doing your errands, make sure you bring healthy snacks with you so you're not tempted to swing by a fast food restaurant and grab something to eat. We'll talk a little bit more about desserts, but if you have the opportunity, fill at least half of your dessert plate with fruit. Fruit is low calorie, tastes delicious, and can help satisfy that sweet tooth. Again, try not to skip meals. Make sure you have healthy breakfast and lunch before your main holiday dinner. And again, eat a little something that's low calorie before you go out to a holiday gathering so that you're not starving when you get there. Fruits and vegetables are a good recommendation. Now here is one of the slides that I liked about how to prepare for Thanksgiving. So here is half the plate with the non-starchy vegetables, things like green beans, carrots, salad, Brussels sprouts. The leanest protein that you have available is turkey. And then here you have your starches, things like mashed potatoes, stuffing, sweet potatoes, and corn actually goes in this category. Now, starches are okay during the holidays. It's what a lot of us love about the holidays. But try to limit the portion to a half a cup and make sure that all of your starches fill in this sort of quarter portion of your plate. So other ideas. Besides what's available here, some other ideas. If you're the one that's preparing for Thanksgiving, cucumber salad is low calorie, asparagus, beets, Even a fruit salad. You could add a fruit salad to your Thanksgiving dinner plate or to the menu. And then other starches to consider besides what's shown here, maybe butternut squash, roasted butternut squash. If you're going to serve a roll, a whole grain roll is better if you can find it. And then another lean protein idea might be Cornish hens. So Cornish hens and turkey are very lean. What about dessert? So if you look at the bottom of this chart here, this is a carbohydrate chart, and I wanted to thank my dietitian for providing this. The lower calorie and lower carbohydrate options are small cookies. So a few ginger snap cookies, a few shortbread cookies, chocolate chip cookies, peanut butter cookies, and sugar cookies. If you'd like to indulge in the pies, pumpkin pie and sweet potato pie probably are the next lower calorie options. Some of my patients have asked me for the eat this, not that chart. And so I brought one here for you today. These are more snacks during the holidays, things to think about for snacks. So here we have healthy unsweetened Greek yogurt or lightly sweetened. So Oikos has a brand that's 000, 0 sugar, 0 fat. That's good. And there's also some light and fit brands that have lower calorie. You can see the difference in calories here, 120 calories as compared to the sweetened Greek yogurts that have the chocolate that goes on top and the almonds. They're nearly double the calories. Look at the difference here that you can save if you choose zucchini pasta as compared to regular pasta. 2 cups of zucchini pasta is only about 70 calories as compared to 2 cups of regular pasta, which is nearly 500. Try not to drink your calories because it's not satisfying and it doesn't fill you up. So any sugar-free beverage or calorie-free beverage is better than a regular soda. When it comes to protein bars, there are sugar-free versions and sort of high-protein, low-carbohydrate versions. Those have a lower calorie content as compared to the energy bars or the granola bars, which tend to have more sugar. When it comes to fruit, berries tend to have a lower glycemic index, meaning lower impact on the blood sugars, as compared to something like a banana, which has a higher glycemic index and more calories. And lastly, for those of you that enjoy rice, cauliflower rice now comes in the freezer section and has a dramatically lower calorie count as compared to white rice. And it's very easy and very quick. So just a few ideas during the holidays. I did want to spend some time talking about holidays and the heart, since cardiovascular disease is the #1 killer here in America. So what we see, and every emergency room physician knows this, is that Americans have more fatal heart attacks during the holiday season than any other time of the year. And the top 3 days for heart attacks here in the US are Christmas, December 26th, and January 1st. You might ask yourself why, what's driving this? And we think it's probably a combination of the unhealthy changes in diet, the higher alcohol that's consumed on those days and around that time, maybe the stress of the holidays, maybe strained finances with the holidays, travel, and entertaining. Now, classic symptoms of a heart attack are chest pain, sweating, maybe pain radiating from your jaw down your arm. But it's important to know that patients with diabetes don't always have the classic symptoms of a heart attack. More commonly, they may describe just extreme exhaustion, maybe shortness of breath or nausea, or pain in the shoulder. So just to be aware that when you have diabetes, the symptoms can be a little bit different. Emergency room physicians are also very aware, as are cardiologists, about the risks of shoveling. So we see higher rates of heart attacks with shoveling in the winter. Snow shoveling is a known trigger for heart attacks. Injuries are also common with shoveling. If it's possible to avoid, to enlist a neighborhood-friendly helper, perhaps, or a nephew or someone else to help out. But if you have to shovel, making sure you do it safely. So use a small shovel instead of a big one. Snowblower if you have one. Make sure you dress accordingly. Make sure you have a hat. Make sure you have proper winter boots, gloves and mittens to cover your fingers. Take frequent breaks when you're shoveling. Make sure you stop to take a drink of water. If you can, push the snow as opposed to lifting it, and making sure that you check your blood sugars regularly. You don't want to go out for 2 hours without stopping to check your blood sugars to see how your blood sugars are, because it really is heavy exercise. Make sure you carry glucose with you at all times. Glucose tablets are easy to keep in your pocket, and they come in a little vial in the event of a low blood sugar. And if you feel unwell at all, make sure you stop, go inside, and seek out medical care if needed. Drink in moderation. So what we consider moderation is 1 drink per day for women and 2 drinks per day for men, if you choose to drink. And the general recommendation is light beer, or beer is better than wine, is better than hard liquor. So if you have a choice, light beer or low carb beer would be best. It has a lower alcohol content and it has less of an impact on your blood sugar as compared to wine and liquor. How does alcohol impact your blood sugars? So it's interesting because initially when you consume alcohol, the blood sugars go up. So they go up at first. But several hours later, typically when you're sleeping, you can have a low blood sugar attacked. And if you're awake, you might notice the symptoms of headache, sweating, shakiness, hunger, confusion, dizziness. But if you've had a heavy meal and alcohol, you may be in a deep sleep and you may not wake up. Occasionally, people can have seizures with severe low blood sugars. Another risk is that alcohol can raise the fat in your bloodstream. We call them triglycerides, and can trigger something called acute pancreatitis. So pancreatitis causes severe central abdominal pain, which radiates to the back. It causes severe nausea, severe vomiting, and is an emergency and requires hospitalization most of the time. And so that's another reason not to overindulge in alcohol in the holidays. And lastly, alcohol can interact with certain diabetes medications. So many of my patients take sulfonylureas. I can name a few: glimepiride, glipizide, glyburide. And when combined with alcohol, that increases the risk for a hypoglycemic event, for a low blood sugar. And so you have to be very cautious. Metformin is another common medication we use for type 2 diabetes. And when combined with alcohol, it increases the risk of lactic acidosis. So the acid levels build up in the blood. So how can you drink safely? Well, make sure you always eat if you're going to consume alcohol. Limit to the recommendations that I mentioned. Make sure you check your blood glucose levels more often, and consider having a snack before bed to reduce the risk of a low sugar overnight. Having a small snack can help prevent that. When it comes to options with drinks, if you can avoid the liqueurs like Irish cream, very sweet drinks like margaritas, pina coladas, and things that require soda, like maybe rum and Coke, that would be better. So there's something called holiday heart syndrome, and this can occur when you overindulge in alcohol. And we do see this around the holidays as well. And what happens is alcohol can actually trigger a cardiac arrhythmia, so an abnormal heart rhythm. The symptoms would be maybe chest pain, trouble breathing, palpitations, maybe dizziness. And so if you feel any of those symptoms, you should seek out medical care the emergency room. Tip number 3, keep moving. The holidays are associated with weight gain and reduced physical activity, like we mentioned before. It's cold. A lot of us want to sort of snuggle inside and hibernate to some extent, but you do need to be mindful of the need for exercise during the holidays. As we said, weight tends to go up in the winter, and hemoglobin A1C levels tend to go up in the winter. So anything you can think of to keep moving. You could try doing exercises at home. There's a lot of things online, like with stretching, with yoga. There's some online exercise classes you could seek out. Chores do count. So doing the vacuuming, doing the sweeping, doing the cleaning, that does count for physical activity. And then consider joining a gym if you haven't already. Consider seeking out a place that has an indoor pool. Anything to keep you moving helps. So the recommendations from the American Diabetes Association are to exercise at least 150 minutes per week with no more than 2 consecutive days off without activity. So that breaks down to about 30 minutes on 5 days of the week. And add that to 2 to 3 sessions of resistance exercise. So that would be something like lifting weights. Try to avoid prolonged sitting. You shouldn't sit for more than 30 minutes. And that's my reminder. We should all stand up, take a little break, and 22 minutes, but prolonged sitting should be interrupted as well. And so some of my patients ask me, how do I afford something like going to the gym? Well, there's free options like walking at the mall if it's too cold or unsafe if there's ice outside. Forest Park is a beautiful park if it's not too icy or it's not too cold. There's some beautiful areas to walk around there. But Planet Fitness is pretty affordable, as is the YMCA. They have sort of, based on your ability to pay, they really have some affordable options. And if you'd like to just stay home and work out, you can live stream workout classes at home. Or I've even gotten some DVDs from the library. You could go to the library and try to find something that you enjoy, Tai Chi, Zumba, whatever you enjoy. Tip number 4, keep up with your medications and glucose checks. So it's staggering to me what the research shows about patients who take insulin. And studies have shown that up to 89% of patients with type 2 diabetes who take insulin do not inject themselves outside of the home. So you think about the amount of time that you eat out at relatives' house, you may be shopping at the mall, you may be eating out, eating away from home. You really do need to carry your diabetes supplies with you when you're having a meal outside of the home, and just to monitor your blood sugars when you're outside of the home. So first and foremost, make sure you have your glucometer with you, and make sure you bring your insulin with you if you take insulin. Some patients take medications at mealtime. So you need to obviously make sure you have those medications with you as well. Now, a lot of us are doing different daily activities than we typically are. We're out and about, we're spending time at loved ones' homes, and it really can make it more challenging to keep up with your medications. So really planning ahead and making sure that you bring your supplies with you is important. What about traveling with diabetes? So many of you likely will be traveling for the holidays. And it's a good, tip to make sure you bring your diabetes supplies with you and your carry-on luggage, but also bring a little bit more than you anticipate in the event there's any issues with your travel home. So a general rule of thumb is pack twice as much as you think you need. Make sure you bring your glucometer with you on the plane along with your medications. And if you're using insulin, make sure you keep it in an insulated bag. Make sure you carry rapid-acting glucose at all times. You can keep it in your pocket. Glucose tablets are a common one. And because your normal routine is off, make sure you check your blood sugars often to monitor. If you're traveling to a new time zone, you may want to adjust the time in your glucometer, or if you're using something like a glucose sensor or an insulin pump, you may also want to adjust the time. And then remember to adjust it back when you come back home. Tip number 5 is really all about how to make sure you keep your feet safe during the holidays, especially with the winter weather. So I've had patients, unfortunately, that spent time shoveling outside during a snowstorm and didn't have proper footwear. And as you're probably aware, they don't have good sensation in their feet because diabetes can affect the nerves in the feet, and they got frostbite, some of them very severe. So make sure that you have proper footwear when you're out in the snow. Make sure that your feet stay dry. Make sure you keep your feet away from the heat when you come back inside. So examine your feet daily. Make sure either you or a loved one inspects all areas of your feet and even in between the toes for any abnormalities, any skin breakdown, any sores, blisters. If you can't see the bottom of your feet and you don't have a loved one to look or help you out with that, you can get a mirror and put it on the ground and put your foot up to it and kind of twist it back and forth to get a look at the bottom of your foot. Again, wear proper footwear. Make sure you have actual winter boots on that are safe and appropriate for colder temperatures and that are roomy enough that fit your feet and keep your feet warm and dry. Skin tends to get cracked in the winter time, and diabetes also promotes dry skin, unfortunately. So it is recommended that you put cream on your feet every night to keep the skin moisturized and reduce the risk for infection. Make sure your toenails are trimmed. This can reduce the risk of a foot ulcer. But please talk to your doctor or your podiatrist, because some patients, especially if you don't have good feeling in your feet, we don't want you to trim the nails yourself. We'd like the podiatrist to do it. And then lastly, make sure when you're warming your feet up, you do it safely. So avoid things like heating pads and electric blankets, because you may not feel if your foot is getting burned because you don't have good sensation in your feet. Make sure you don't soak your feet in warm water, because you might not be able to tell if it's too warm unless you check it with your hand ahead of time. You also don't want to soak it for too long of a period, because you can get skin breakdown. And make sure you don't try to warm your feet on a radiator. I've had several patients that actually burned their feet because they didn't feel it because it was too warm. So protect those feet. Now, what about socks? Many of my patients ask me, what kind of socks should I be wearing? What kind of shoes should I be wearing? And many authors recommend cotton or wool socks, but most importantly, make sure it's the kind that wicks away the moisture. So the whole goal is to keep the foot dry and keep the foot protected. So make sure you have socks and shoes on at all times, even indoors. And try to make sure your socks are not too tight. You want to make sure that the toes and the feet are getting good circulation. There are diabetic specific socks if you are looking for something online or in the store. And what about diabetic shoes? So there are diabetic shoes available, and we do recommend this for anyone who has diabetes and neuropathy, so they don't have good feeling in their feet, or they have diabetes and a foot deformity, maybe bunions, maybe overlapping toes, maybe hammer toes where the toes are curled up, to reduce the risk of problems. And I think it's important for everyone to know that Medicare often will cover diabetic shoes. They often will cover one pair per year. So that can be a big savings. You know, diabetic shoes can even be up to $100. So talk to your doctor to see if you're eligible. And in general, we recommend avoiding shoes that have the pointed toes, avoiding high heels because of the different pressure that you put on the feet. You're looking for comfortable shoes with a cushion. And leather, canvas, and suede tend to have a little more give to it to protect the feet. Now, some of my patients, they have kind of a belief that diabetic shoes are unattractive, but really we've come a very long way with diabetic shoes. So these are all diabetic shoes. I think I would wear 4 or 5 of those pairs. So really the whole concept of traditional diabetic shoes is really out the window. And they come with sneakers, they come with boots, they come with casual shoes. So really, there is quite a bit more variety these days. Number 6, beat the winter blues. So I know we've seen a lot of depression and mental health disorders with COVID the past year and a half. And many of you are probably aware that a lot of patients also suffer from depression just from the winter holidays and just from the shorter days. The shorter winter days with less sunlight can affect your mood. Most of the time, the symptoms are mild and temporary, especially when it's related to the winter, but some cases can be more serious. So there's something called seasonal affective disorder, and it's a type of depression that really only occurs during the winter, and the cause is the lack of sunlight. So the shorter days and more time inside leads to lack of sunlight and contributes to this condition. And it's not that rare. 1 in 20 people struggle with this seasonal affective disorder. The symptoms that are described are feeling anxious, irritable, having trouble concentrating, tired all the time, losing interest in your usual activities that you used to enjoy. And so if you think you might be in this category or you're worried about a loved one, there are some treatments for seasonal affective disorder. Light therapy can actually be helpful. There's light therapy boxes that you can purchase. Counseling can be helpful, and medications are sometimes needed. And the general recommendation, if you are going to do the light therapy, is you have to have your eyes open, not looking directly at the light, but for about 30 minutes in the morning within an hour of waking up, just getting some UV exposure to help sort of combat this seasonal affective disorder. This woman had her eyes closed, so she wasn't really getting the full benefit. And I thought it was important to mention that suicide rates do increase with age. And so we see a steep rise in suicide rates in younger individuals, between the ages of 10 and maybe 25. And here we have females in orange and males in blue. But look at what happens after the age of 65. There is definitely an increase in suicidality in individuals after the age of 65, and it seems to be more common or more mediated in males. So if you know somebody that's struggling with depression, that's thinking about suicide, or you yourself are thinking about suicide, I wanted to share the suicide hotline. We have one here in Springfield. The number is 413-733-6661. And you might just want to jot that down in the event you talk to somebody and they're struggling, because there is someone to help. There's always someone to help. Now, depression and diabetes really are closely linked. So as you can imagine, having diabetes is a chronic condition, comes with a lot of stress, comes with some complications, maybe foot ulcers, maybe a heart attack, maybe a stroke, maybe lack of feeling in your feet. And so there's a lot of complications that can come along with diabetes, and a lot of decisions around healthy foods and exercise. And all of that can lead to depression. And having depression can make you unmotivated to exercise. It can make it harder to remember to take your medication. It can make you want to stay in the house and maybe sleep all day. And that leads to higher blood sugars, higher hemoglobin A1C. So it really is kind of a vicious circle, and they are very much linked together. And so making sure you reach out for help. There's always help available. There's counseling, there's medications, and talk to your doctor. So what can you do to beat the winter blues? Staying active. So physical activity boosts your natural endorphins. Those are your happy hormones. So exercise actually boosts your own happy hormones. Make sure you connect with others. I know it's been so hard with COVID the past year and a half, but that can also boost your endorphins. Just being with friends and family can improve your mood. Making sure you're making healthy food choices that boost your energy as opposed to making you tired. Make sure you get plenty of sleep, and the recommendation is around 7 to 8 hours. Think about playing outdoors with your grandkids, making a snowman. Some of the senior centers actually have exercise classes, and many of the gyms have exercise classes, and they have aquatics classes. So thinking about partaking in some of the activities in the community as well. So some take-home points for today. Really, the holidays are a wonderful time to connect and spend time with families and friends, and I know I'm looking forward to it. But when you have diabetes, there are a few additional things to consider with your diet, with exercise, and medication management. With the winter, you have to be very mindful about how cold impacts your body, especially things like fingers and toes, and making sure your medications are safe and being stored at the proper temperatures. And really, you can navigate the holidays as long as you plan ahead. Plan ahead with your meals, plan ahead with your travel, and plan ahead with your exercise. And that will help keep you healthy. So that was what I had for today. I did leave some time for questions.
Thank you, Dr. Gordner. Those were some great tips that definitely I will be using myself. So thank you for your time and your expertise. We invite the participants or attendees to type any questions you may have in the Q&A box, possibly to the right-hand side of your screen. Zendaya would like to know if you're taking any new patients.
Absolutely. So I actually see kids and adults. So my pediatric office is at 50 Wasson, and my adult office is at 3300 Main Street. So both are with Baystate. And yes, we are definitely taking new patients. I'm starting to think about my Thanksgiving meal plan and how I can make it healthier.
Right. Well, this is why your topic is so timely, because it's, like you said, you really need to plan ahead for that. Amanda has a question. What's the best approach for convincing a loved one to be on top of their diabetes?
Yes, that is a challenge. And I share the same challenge with my patients. It's always about trying to find out what motivates them. I find what's important to them. If it's making sure they make their grandchild's graduation or wedding, perhaps, or it's important for them to be able to participate in family activities and be healthy to be able to leave the home. I guess it's finding out what's important to that individual and helping them make the connection about staying on top of your health, including your diabetes, is the way to get to that goal. So helping to make those connections between staying healthy and achieving what their goals are. But that is a challenge.
Well, it's a good time for the holidays for those kind of suggestions to your family and your loved ones.
Mm-hmm.
How do you recognize when someone may be in distress?
Yeah, so with diabetes, that could mean a lot of things. You could have a hypoglycemic event, a low blood sugar event, and that could be causing a severe acute distress. The patient may be sweating, they may be altered, confused, they may not be answering questions appropriately, they may be slurring their speech. So that would be kind of an acute event, and signs and symptoms to look out for. And you should bring them some source of glucose, so juice, regular soda, glucose tablets, lifesavers. We use diabetes distress sometimes in a different way. So diabetes distress is the overall burden of diabetes. I'm not sure which exactly it's referring to, but I guess if you're referring to the overall burden of diabetes and is that impacting your loved one, it's really talking to them about it. How are you doing with all of this? How are you managing? Are you doing okay? Really just talking to them one-on-one, heart to heart, to see how they're doing. Because, as a medical provider, there's always other options to sort of achieve the goal. So there's other medication options, there's other food options, there's other ways to test your blood sugar if they don't, really have trouble with that. But really, it's an open one-on-one conversation with the individual. That would be kind of another way to look at diabetes distress.
Thank you. What are some of the signs that my blood sugar is too high or too low?
Mm-hmm. So it's interesting. So people experience the symptoms of high blood sugar differently. So if you're someone who commonly has high blood sugars, whose blood sugars say run in the 200 to 300 range often, you may feel normal at those blood sugars, but that doesn't mean it's good for you because there's health consequence with having your blood sugars too high. Symptoms of a low blood sugar are things that I just mentioned: being sweaty, being confused, hungry, shaky, tremulous, maybe slurring words. So those would be symptoms of a low blood sugar. And what we find is if you tend to have very high blood sugars, say 200 to 300 range, and you start taking your medication regularly, and we bring those average blood sugars down to the normal range, say more in the low 100s or mid 100s, your body will adapt and will start feeling normal at those blood sugars.
Well, thank you. That's good to know. Next question. Does nerve damage extend to the hands as well as the feet?
So when we talk about diabetic neuropathy, another term is peripheral neuropathy, we know that high blood sugars can damage the nerves, and it tends to start in the toes or in the feet and sort of moves its way upward. So typically you wouldn't get anything in your hands before the feet. Kind of it starts distally, starts far away and moves up towards the hands. So I would say more commonly, neuropathy in the hands is often due to something else, maybe carpal tunnel, maybe an impingement in the neck. It is possible with longstanding diabetes that you can get neuropathy in your fingertips, but less common overall, definitely much more common in the feet. Some of my patients that have had diabetes for many, many years, they've done a lot of finger prick testing. And so they've, pricked their fingers maybe 5 times a day for 40 years. And so sometimes right in the tips where they've done all the finger stick testing, they might lose sensation right in the tips there. But that's probably just from the repetitive trauma from the testing. We now have continuous glucose monitors that go on the arm that some patients are eligible for, especially if they're on insulin. And then you don't have to check your fingers anymore. You get the blood sugar just from the monitor.
Thank you. When I'm traveling with my monitors and equipment, do I pack it in my suitcase or do I bring it on board with me?
Mm-hmm. So we always recommend to carry all of your diabetes supplies, including your glucometer and your medications, all of your testing supplies in your carry-on bag, simply because the checked baggage just has a risk of being lost potentially, and you can't go without your medication. I will say if you have an insulin pump or a continuous glucose monitor, we generally recommend not going through the airport scanners. You can check the manufacturer, but the general recommendation is to request a pat down instead of going through the scanners to make sure there's no damage to those devices.
Oh, interesting. That's a great tip too.
Mm-hmm.
Thank you.
Mm-hmm.
I don't see any questions. We'll just give everybody another few minutes. But I thought the tips on the food and the exercise were excellent too. Something that we could all use, frankly.
That's true.
It looks like that's it. But I want to say happy Thanksgiving to you, and thank you for your time and expertise on this terrific topic. We appreciate your time. And thank you so much and wish you happy holidays.
Thank you, Sue, and thank you so much for the opportunity. It really is a pleasure coming to meet with your group. And yes, here we are. I can't believe holidays 2021, they're upon us. Enjoy.
Thanks.